4 of every 10 people in Uganda are potential patients for heart disease. This, according to Dr. John Omagino, the executive director at the Uganda Heart Institute, is because of predisposing factors like high blood pressure.
A survey done in 2016, the study, a quarter of our adult population, both in the rural and the urban area, already have hypertension, which is a bed mate for a disease. Whether you're a neonate, whether you are a child, whether you are an adult, whether you are an old person, the whole life cycle is affected. The babies are born with congenital heart disease. The younger children get infections and end up with rheumatic heart disease. The older people get ischemic heart disease. All this is what is contributing those numbers. But if you dissect it and break it down, there are figures which are international and you can't change. 1% of every 1% of babies born in any country have heart disease. So for Uganda, we are delivering 1.6 million babies, yes, per year. 1% is 16,000 have disease. Our job is to catch them. And 50% will require an intervention if they are to live a life which is meaningful or totally corrected.
The predisposing factors are now more of lifestyle practices that contribute greatly to a problem, statistically tallying up to 1,210 deaths between 2010 and 2016 in Uganda. Dr. Paul Kasenene, an expert in nutrition, lifestyle and functional medicine, says simple adjustments in feeding and diet can go a long way to keeping oneself healthy.
We need to eat foods that are high in fiber. Fiber is a part of food that helps to regulate our blood sugar, our blood pressure and our cholesterol level. Fiber is found in natural things like whole maize, like millet, like nuts, like seeds. These are very, very good foods. It's important to eat a lot of vegetables. Green leafy vegetables also have a lot of fiber, and they also have a lot of vitamin K, which is very good for your heart. And not forgetting fruits.
Prevention is basically the way to go, as advised by Dr. Gerard Mutunji, the head of non-communicable diseases at the Ministry of Health.
So it's about physical activity, nutrition, alcohol and tobacco, and then physical checkup.
The Ministry of Health has further pledged to make diagnosis easier for the public because they want to emphasize the message of prevention being a much cheaper option than cure. Treating ailments from heart disease is quite costly. You may have to spend at least 20 million shillings for a procedure at the Heart Institute, but this could more than double to hundreds of millions for treatment outside the country. Walter Mwesigye, NTV.